How's it going? My name is Matthew Tenoy. I'm an applied exercise scientist who studied at Azusa Pacific University. From there on, I went to achieve my corrective exercise specialty, and also I specialize in performance enhancement as well. Today, I'm going to talk to you about lower back pain relief. This hits home for me because I also experienced lower back pain, but I've also experienced the joy found in relieving the lower back pain by taking a corrective exercise approach to this common problem. It's actually estimated that 80% of Americans will suffer from lower back pain at some point in their lives. And mostly it's because of our daily movement patterns. A lot of times we spend sitting throughout the day. We also spend time driving or sleeping on your side. And all of these things just added up through daily movement patterns have an impact on our body, leading to lower back pain. Over the past few years, through working through physical therapy clinics, working with pediatric cancer patients, working as a master trainer at a world-class health and wellness club, I've been able to really practice a research-based approach with many of my clients and people who come into my life. And I was able to really see how their body would adapt to these changes and how they would also see results in reducing their risk and reducing the pain that they feel in their lower back. From here, I've collected a little bit of a sample that I would like to share with you today. It's over an hour of videos where we go through a research-based approach where we focus on relaxing muscles that are a little bit too tight through a technique called SMR, self-myofascial release. From there, we follow a research-based progression to lengthen those muscles through specific stretches to target specifically tight muscles that affect lower back pain. And finally, we strengthen muscles that are underactive. And so we strengthen muscles that will help promote a healthy back. So through this progressive corrective exercise system, I know it's worked for many of my clients, and I know it's worked for myself as well, and I am joyful to share this with you, and I hope that you see results as well. We are going to use self-myofascial release techniques using 2 tennis balls duct taped together. In the middle of the 2 tennis balls, there's a little gap, and that's where we put your spinous process, or the bony part of your spine. So we start on the lumbar spine, your lower back area, and we put, again, that bony part of the spine in between the tennis balls so that the spine does not have any direct pressure on it, but the muscle around the spine has that pressure. We then try to press our back into the tennis balls, and you can even raise one leg to increase the pressure and raise the opposite leg, kind of increasing the pressure on the tennis balls to just promote the muscle to relax a little bit more. You can also kind of move the hips into a posterior rotation and anterior rotation, as you see me doing in the video. And this is a self-oscillation technique, which can be used to create more mobility through the joints of your spine. Sometimes back pain is caused from muscles that are a little bit too tight in the lower back, but also it could be that the back may be a little bit too stiff or joint stiffness throughout your lumbar and thoracic spine. And so what you see me doing is after a few oscillations and relaxation at each vertebrae, I'm going to move the ball up to the next vertebrae and then repeat the same movement. Through doing this technique, you'll start to feel a little bit more loose coming through the back. And if you have a spot that's a little bit tender, you're actually going to pause on that area for a little bit longer, waiting for the muscle to relax. And then once it relaxes, you can try some of the oscillation techniques and just to kind of promote the relaxation of the muscle and then go into the joint mobilizations through the oscillation technique. So as we do this, we create more range of motion for the joints, which will decrease your risk of lower back pain. We also help to relax your erector spinae, which is the prime mover in lumbar extension. And when that muscle gets too tight, it can cause a little bit too much of an arch in the back, leading to lower back pain. So many movements we compensate by loading our erector spinae, and that muscle typically does get overactive. And so it is important to use self-myofascial release to relax that muscle. In this video, we are using tennis balls. I know foam rolls are very popular as well, but tennis balls work just a little bit better to really dig into the muscles without aggravating the spine directly. So I'd encourage you to really practice this, and I hope that you see results. Hey guys, so what I have in my hand is a foam roll. A foam roll you can pick up at any sporting goods store. It's going to be around $15 to $30, but it's used to help relax tight muscles. So first, what we are going to relax is our calves and soleus, which are muscles that really affect the knee, but also the foot and ankle complex. So the calf and soleus, I'm sure you know where your calves are. Your soleus is just right below the calves, and what you see is me applying pressure to the calves and rolling back and forth. This will cause the muscle to relax. This will provide more range of motion, leading to less movement patterns that are faulty. Usually calves get tight when through different movements. So if you walk a lot, if you wear high heels or dress shoes, having your foot in a plantar flexed position typically causes tight calves. And because we use calves every day, whenever you walk, whenever you do anything, pretty much your calves are always being worked, and they're always being in your ankles always going into plantar flexion, so causing tight muscles in the calf and soleus. But typically, we never actually stretch or lengthen or relax the calves like we should. So this is one way that we are going to relax them. Again, what you see me doing is rolling over the calf and soleus area. When you get to a tight spot, you want to pause on that spot and try to let that muscle relax. Typically, calves get really tight. I know mine, I have quite a bit of tender areas, and sometimes it's a little bit more painful. But you want to try to fight through the pain, roll through it, and again, if you feel a tight spot, just pause on that area until it starts to calm down, and then roll back and forth again. And you'll definitely notice that as you continue rolling, then the calf muscle and the soleus will begin to relax. So from this view, you can see that I'm alternating between both legs. So this is a beginner view where you can stay on one foot on the ground, one foot up. If you want to apply more pressure, you can put one foot on top of the other and pressing more weight down on top of the calf and soleus. So there you go. This is the calf and soleus foam roll. I hope that helps, and I hope that you see results. All right, well, our next exercise is to foam roll our quadriceps. Our quadriceps are made up of 4 muscles, and when they get too tight, then they can pull on the knee, and they can also pull on the hip, leading to lower back pain. So the quadriceps, they are located on the anterior aspect of your thigh. So you see me placing the foam roll on top of the quadriceps, rolling back and forth. If I get to a tight point, I'm going to pause at that point and bend my knees, moving the muscle through flexion and extension. This will cause the muscle to relax at a much deeper level. It's similar to this technique called active release therapy, where you pause on a tight adhesion or knot in the muscle and move the joint back and forth through its range of motion, helping to relax the muscle. So we're trying to use that technique here when we roll out the quadriceps. So what the quadriceps do when they get too tight, especially the rectus femoris, one of the 4 quadricep muscles known as the rectus femoris, it also attaches above the hip, and when it gets too tight, it can pull down on the hip, leading to an anterior pelvic rotation. What that can cause is an increased curvature of the lumbar spine, leading to lower back pain. So it becomes very important to maintain proper flexibility and relaxation of the quadriceps. And foam rolling is definitely a technique that needs to be used. Foam rolling stimulates an organ in the muscle, called your Golgi tendon organ, to relax the surrounding muscle. It's stimulated when we apply pressure to that muscle. So similar to a deep tissue massage, we're foam rolling. We're applying pressure to the muscle, causing it to relax so that we can see the results of less lower back pain. So again, we're rolling back and forth. When you get to a tight spot, you pause on that spot and you bend the knee in and out, moving the muscle through flexion and extension. Well, there you go. And when you look at it, you want 3 sets of 30 seconds, rolling out, and pausing when you get to tight adhesions or parts that are a little bit more painful. Well, that's it for the quadriceps. I hope this helps, and I hope you see results. Thank you. All right, well, our next exercise is to foam roll our adductors. So adductor brevis and adductor magnus. These are 2 muscles located on the inner part of our thighs. So the way to target that is to kind of straddle the foam roll and to roll out. Roll out, again, the adductor brevis, adductor magnus. The main motion of the adductors is, well, you guessed it, to adduct, to bring the knees in towards the center or towards the midline. Now, usually when the adductors get too tight, they can pull your knees too far in, leading to an increased anterior pelvic tilt, also leading to knee pain. So it's a very important muscle to keep relaxed and flexible. So foam rolling is a way to relax this typically tight muscle group. Especially for women, you have a wider Q angle, which means that from your patella to your hip bone, there's an increased angle, leading to an increased risk of excessive adduction. This makes it even more important to foam roll out the adductors. So when the knees cave in, it goes into knee valgus. And knee valgus causes numerous problems. It can put extra stress on the knee, but it also messes with the hip, the lumbopelvic hip as well. So you really need to foam roll out the adductors, and that will cause there to be less tension in the adductors, so less of a pull on the knees into knee valgus. This will help keep you aligned and will help to prevent any type of postural distortion coming from the hips, the knee, or the foot and ankle. Later on, we'll focus on strengthening one of the antagonists or opposite muscles of the adductors. But for now, as you see, I'm going to straddle over the foam roll, place my adductor on top of the foam roll, and roll back and forth. Again, most of the research in the field is suggesting that we foam roll for at least 30 seconds for 3 sets. This provides an adequate amount of time for the muscle to adapt and to lengthen and to relax. So you want to do 3 sets of 30 seconds on each side, rolling out the adductors and decreasing the tension in this typically tight muscle. Well, I hope this helps you. I hope this helps prevent any type of lower back pain or knee pain as well. All right, well, our next foam rolling exercise is to foam roll your piriformis. So your piriformis is typically a very tight muscle group, and this is seen multiple times in my years of experience at physical therapy clinics. Whenever someone comes in for lower back pain, the piriformis is usually something that's overactive and needs to be relaxed. So what we're doing is we are sitting on top of the foam roll, and we are actually going to pull one foot on top of the knee and try to lean in and really target the piriformis. It's a smaller muscle located in the hip. But the thing is that when this muscle gets too tight, it can lead to an excessive lean forward when you bend down to pick something up, or it could also lead to an asymmetrical weight shift, which could even lead to lower back pain problems, also problems such as sciatica. So it's a very important muscle to stretch and lengthen and relax. So here, as we're foam rolling this muscle, we're relaxing it, rolling back and forth, trying to dig in to the piriformis. It typically is pretty tight, and usually you will feel it at this point. Sometimes to get even a deeper stretch, you can or a deeper relaxation, you can actually sit on top of a softball. I know some of the athletes I've worked with, we've actually used softballs to roll out around their piriformis to relax the tight muscle. So when this muscle gets too tight in the hip, it doesn't let you drop into a good squat, and so your body goes through different compensations. One of the common compensations that we see is someone starts to round at the back when they go down into a squat. We never want that. We want you to have a neutral spine when you squat down. So we are targeting the root cause. We're not targeting just the problem area. We're trying to find what the source of the pain is. And more often than not, it's coming from the piriformis, an overactive muscle group located in the hip. It's kind of tricky to target this muscle. So again, as you see me sitting on top of the foam roll, I'm pulling my foot up on the knee, and I'm leaning my body, trying to lean into this muscle. This is the way that we are going to target the piriformis, and we roll back and forth, letting it relax. Again, we want 3 sets of 30 seconds on the rolls. Rolling back and forth, trying to find spots where it's tender. You may even want to pause where it's more tender to cause the muscle to relax. But to continue, again, 3 sets of 30 seconds On each side, this is a very overactive muscle, so it should be beneficial to spend some time on it, roll it out. And definitely, like again, if you go into any physical therapy clinic for lower back pain, they're going to target maybe the hamstring hip flexor, but definitely the piriformis is going to be a muscle of importance. So, well, I hope this helps. Have fun rolling out the piriformis. It's going to help you, and you'll see results. So our next exercise is the foam roll of the iliotibial band, also known as the IT band. Now, this foam rolling, this exercise, does not only prevent lower back pain, but also things known such as runner's knee. This is a very important exercise to be keeping up with as well. So we're rolling back and forth on the lateral aspect of the thigh where the IT band is located, and it's going to be painful and it's going to be pretty sore. So that's why we have one foot in front of the other planted on the ground to take off some pressure. Now, as the muscle begins to relax, it'll feel less and less tense, and you'll be able to put more pressure on the IT band. So we're rolling back and forth. When we get to a tight spot, we pause and we bend the knee in and out, going into flexion and extension, kind of stretching the IT band and then flexing it. The muscle that's connected to the IT band is known as your TFL, known as your tensor fasciae latae. But as we roll out the IT band, the TFL will decrease its tension as well. When we apply pressure, it causes the muscle to relax. It stimulates this thing called your Golgi tendon organ. I went over that a little bit earlier, but applying pressure on the IT band will cause the muscle to relax and prevent movement compensations. The main faulty movement patterns we see with a tight IT band is internal rotation of the knees, asymmetrical shifts in our weight, which can lead to lower back pain. It can also increase the curvature of the lumbar spine, leading into an anterior pelvic rotation. So by foam rolling this muscle out, you can relax the tightness in this muscle. So by foam rolling the IT band, we can prevent different types of impairments, and you will hopefully see results. Thank you. Well, in this next exercise, we are foam rolling the thoracic spine. Now, in the previous videos, we focused more on lower body, but also what's stacked on top of your lumbar spine can have an effect on lower back pain. And so the reason we are foam rolling out the thoracic spine is more of a mobility exercise, creating more mobility throughout the thoracic spine, causing it to be easier to retract and depress the shoulder blades into good posture, which in turn will help you to have a healthier lower back. Now, when you look at lower back pain, you not only look at what's happening below the back, you also look at what's happening above. And that's why I'm including the foam roll of the thoracic spine here. You put the foam roll right on your shoulder blades. You roll back and forth on the shoulder blades. It helps mobilize the joints, and it helps to, again, increase the mobility, and hopefully you'll see results, seeing less lower back pain. So this next exercise, we are going to foam roll the pectoralis muscle groups and also the anterior deltoid. Now, it may be confusing thinking that, well, this video is supposed to be for lower back pain. Why are we foam rolling the pecs? Well, again, like I mentioned in my previous video, you have to look at what's happening above the lower back as well as what's below the lower back. And above the lower back, when the pecs and anterior deltoid, so when the pectoralis major and minor, anterior deltoid get too tight, they can cause a rounding of the thoracic spine. This will increase the pressure put on the lumbar spine, leading to lower back pain. So to prevent what's known as upper cross syndrome, we need to relax the overactive muscles in the upper body. So we roll out the anterior deltoid and the chest. This will decrease the activation in these muscles and allow you to, again, hold yourself in better posture, keeping the shoulder blades back, retracted, and depressed down. This will help load the lower spine, so your lumbar spine, a little bit better and lead to better results when working on your lower back pain. So again, it's not only important to foam roll what's below the lower back, but also looking at the postural compensations that happen above the source of pain. So I hope these videos help you understand how to relax the chest, how to relax the anterior deltoid, causing it easier to hold good posture, and in turn, preventing any further occurrence of lower back pain. Well, our final foam rolling exercise is for the latissimus dorsi. The way we are going to target this muscle is by bringing the foam roll below our armpit and rolling back and forth. Now, the lats are a very broad muscle and they cover most of our back. However, we are focusing on an area of the latissimus dorsi which is more related to the shoulder blades. When we relax this muscle, it will prevent the lats from pulling our shoulders forward into protraction. When the shoulders fall forward, it can increase the stress on our lower back. The shoulders falling forward is a term known as an increased kyphotic curvature. So as we relax the lats, we can decrease the kyphotic curvature and promote a more healthy upper body posture. This will create a more stable posture, and it will also help load the weight properly on the lower back, and that's how it will help us prevent lower back pain. So when you look at the research for foam rolling, again, you want 30 seconds per muscle group, and you want 3 sets. So 3 sets of 30 seconds, rolling back and forth. If you get to a tighter spot on the lats, take a little pause, let the muscle relax, and the more you foam roll, the more you pause on it, the more it will relax and the more tolerable it will be. Don't be scared. In all of these foam rolling exercises, if you feel pretty painful at first, if you can't handle a lot of pressure on the muscle, don't worry about it. Your body will adapt to the stresses we place on it. And as we relax the muscle will become more and more relaxed and less active. Later on, we'll look at how we're going to strengthen these underactive muscles and how we're going to lengthen the overactive muscles. But the first step is to relax overactive muscles. That's why all of our foam rolling videos are very important to keep up with. We're following a progressive system where we go from relaxation through foam rolling. Then once the muscle is relaxed, it's more receptive to being lengthened. And finally, we end with strengthening muscles that are a little bit too weak. In this exercise, we are specifically targeting an overactive muscle group called the latissimus dorsi. And we're rolling this muscle out for 3 sets of 30 seconds, letting the muscle relax, which promotes a better upper body posture and helps you stack the weight properly on your lower back, which helps prevent any future lower back pain. While this is more of a research-based approach to lower back pain, I hope you enjoyed this video and I hope that you see results. Now we are moving into the stretches. Our first stretch is called the single knee to chest. This stretch helps open up the hips and also places a stretch on the hamstring. Most of the research in the field suggests that we stretch for 30 seconds at a time. This gives the muscle adequate time not only to adjust to the stretch, but also to lengthen the muscle. We are trying to lengthen these overactive muscles. What we're focusing on here is the hamstrings. When the hamstrings get too tight, they can cause synergistic dominance of the glutes, which basically means that your hips will not be as strong because your hamstrings are so tight. This will cause a anterior pelvic tilt, leading to lower back pain. By adequately stretching the hamstrings, we can prevent this postural compensation, and you can promote a healthier back. So again, this first stretch, single knee to chest, you bring your knee up, grab on your knee and pull towards you. As you can see, I am not flexible. Flexibility is one of my biggest weaknesses. So I definitely need to be keeping up with these stretches as well. As a corrective exercise specialist, sometimes the hardest part of my job is to practice what I preach. But you have to stretch, keep your body in motion. Because, well, as they say, a body in motion stays in motion. Well, I hope this helps for the single knee to chest. You should feel it coming through the hamstrings. It'll help open up the glutes and prevent you from having any lower back pain. Well, if you remember from a previous video for foam rolling the piriformis, Now we are going to lengthen the piriformis. We follow a progression where we first relax the muscle through foam rolling, and then we lengthen that muscle through a static stretch. This is much more beneficial and much more helpful as we start to stretch the piriformis. So what we're going to do is we're going to take one foot, plant it on the knee, grab your ankle, push out on the knee with the opposite hand, and that amount of torque and that positioning specifically focuses on the piriformis. This will help cause the muscle to relax. And you want to hold for 30 seconds at a time, repeating for 3 sets of 30 seconds on each side. Now, in the previous video, we went over the numerous complications that happen with a tight piriformis. Again, a recap on that is that a tight piriformis can lead to an increased curvature in the lumbar spine. It can also lead to knee adduction, and all those things put together can just cause excessive stress on your lower back pain. And again, we talked about the importance of sciatica and tight piriformis and how we really need to focus on this muscle so that we can promote healthy movement patterns. So we're relaxing the muscle, we're pressing into this stretch. As we hold, the muscle is going to respond by lengthening the muscle fibers, decreasing the activity in the muscle, and that will help give you a more balanced posture, especially when it comes to the lumbopelvic hip complex. You're going to hold for 30 seconds at a time, and this exercise will definitely help you, and hopefully you feel the results and less lower back pain. Alright, well this next stretch we have is for your erector spinae. Your erector spinae is the muscle group that extends your spine, especially at the lower back. So when you reach back or when you lean backwards, when you feel your back arch, that's your erector spinae that is tightening up. Now, the erector spinae, it's good to strengthen in certain ways, but when it gets too tight, it can lead to different postural compensations. Your erector spinae attaches to your pelvis, meaning that when it gets too tight, it can pull at the pelvis upwards and it increases what they call an anterior pelvic tilt. When you have an increased anterior pelvic tilt, it gives you a risk factor that is much higher for lower back pain and other sorts of movement impairments. Now, no one should live with pain, and so through our corrective exercise program, we have focused on relaxing certain muscles through the foam roll. Now we're focusing on lengthening different muscles. And in this exercise, we are lengthening your erector spinae. It's estimated that around 80% of Americans will have lower back pain at some point in their life. And that's mainly because of our lifestyle habits. If you look at what most Americans do, we spend a lot of time sitting, a lot of time sleeping on our side, and a lot of time driving. All of these things are just terrible for our lower back. It puts so much stress on our lower back, and all this tension and tightness in the muscle in the erector spinae just leads to more and more pain. And we live through that same cycle over and over again and never do anything about it. So this gives you a plan. It gives you a corrective exercise strategy to live without pain. No one deserves to live through pain. And so with this exercise especially, we are focusing on the erector spinae. So the key to this is you want to keep both shoulders on the ground and then pull one leg across your body. You then put one hand on your knee and pull down, and that will increase the stretch. Now you may feel some of the stretch coming through the hip as well, but what's also being stretched is your erector spinae. Your erector spinae attach on either side of your spine. And so that's why we are going to stretch each side by rotating one leg over the body and then rotating the opposite leg over. Each time we do this, we want to hold for 30 seconds. So you're trying to hold for a 30-second stretch on one side and then a 30-second stretch on the other side. Now, it may seem a little bit too much to spend that much time stretching, but honestly, when you look at the research, they suggest that you really need to spend 30 seconds per stretch. Otherwise, the muscle does not adapt fully, it doesn't lengthen fully, and you're not really helping yourself. So go ahead, try this stretch out, 3 sets of 30 seconds on each side. and I really think that you'll see results from this program. All right, we are going into the hip flexor stretch. In this stretch, we're going to plant one foot in front of the other. Make sure your core is braced tight because we don't want the back to arch as we drop down. And we're going to push your hips down towards the ground, causing a stretch coming through the groin area, which is also known as your iliopsoas complex. The hip flexors are made up of the iliacus and the psoas major, as well as the rectus femoris, which is one of your quadricep muscles. Now, all of these muscles, they flex at the hip, and typically through patterns of daily movement, they tend to make the hips get too tight. And when this happens, it can actually pull on your pelvis downward, causing an increased anterior pelvic tilt, resulting in lower back pain. So by maintaining proper flexibility of the hip flexors, we are going to help promote a better lower body posture, which in turn will reduce our lower back pain. Now, one modification to this stretch would be to plant your foot up and then also turn it out, going into abduction. Then we're going to lean towards that knee and also push our hip forward to increase that stretch. This is a modification of the hip flexor stretch, which does also really target the hip flexors. It gets a little bit of adductor in there as well. But again, targeting tight muscles that may lead to lower back pain. So we lean towards the knee, push the hip out, feel a stretch coming through the hip area, and then again, what the research suggests is that we spend about 30 seconds lengthening the hip flexor. 3 sets of 30 seconds is our goal for these stretches. That provides adequate time for the muscle not only to respond by relaxing, but also to actually lengthen the muscle fibers, which decrease the muscle activity, which pulls down at our pelvis and alters our mechanics. Patterns of daily movement that usually cause tight hip flexors are usually when someone sleeps on their side. The hip will be in that shortened position. I know many of my clients, they spend a lot of time sitting and even driving, really. Your hips are always in that flexed position. And I know everyone's obsessed with getting a six-pack and do numerous ab exercises. And so many ab exercises, the hip is always being flexed, and it can really cause tight hip flexors. So it becomes very important because of our daily movement patterns, because our hips are always in that flexed position, to really focus to increase the flexibility in our hips through hip flexor stretching. Hip flexors are one of the main muscle groups physical therapists or corrective exercise specialists will focus on as they treat someone for lower back pain. Later on, we'll learn how to strengthen the antagonist or the opposite muscle of the hip flexors to offset an anterior pelvic tilt as well. Your body is kind of a kinetic chain of movement, which means that when one area gets too tight, it can throw off the whole body. And we definitely are predisposed to tight hip flexors. So we really need to focus on lengthening these hip flexors and keeping them flexible to promote a healthy body. And by strengthening the hip flexors and lengthening them in the proper ways, we're actually going to be able to see the rest of our body fall into proper alignment as well. Well, I hope this exercise helps. Hope you continue to stretch, and I hope you see results. All right, we are going into a straight leg stretch where all you need is a belt or a rope. You're going to place it on the upper part of the heel, lean yourself back, and try to pull at the leg up towards the opposite shoulder. You should feel a stretch coming through your hamstrings. Now, as you're pulling, again, if I'm pulling from my right leg, I'm going to pull towards the opposite shoulder. This will focus on the biceps femoris of the hamstring, the lateral aspect of the hamstring. To increase this stretch, I could even cross it over my body, and that could focus a little bit more on that part of the hamstring as well. Typically, the lateral aspect of the hamstring is the part of the hamstring which is a little bit more tight or a little bit more overactive. You can kind of feel how tight it is. It's that rope-like structure on the outside of the hamstring. When you bend the knee, you can kind of feel where the short head of the biceps femoris is in the hamstrings. But typically that muscle group gets really tight, and so it becomes very important to stretch with a purpose when it comes to stretching a hamstring. We don't simply want to raise the leg up and try to feel a stretch somewhere, but we actually want to take a research-based approach to stretching. We want to understand what we are trying to feel, and you're trying to feel a stretch in the hamstrings, but more importantly, you're trying to feel the stretch in the outer part of the hamstring. This focuses on the short head of the biceps femoris, which is a very overactive muscle in most Americans, and it will cause less lower back pain as we relax this muscle. When the hamstrings get too tight, it creates what's called synergistic dominance. It takes over control of what the glutes are supposed to do. This leads to decreased glute strength and can lead to an anterior pelvic tilt, causing lower back pain. So when we look at lower back pain, we always try to find the source of the problem. The short head of the biceps femoris and the hamstrings is definitely one of those muscles which is a source for the problem of lower back pain. Through this stretch, we are taking a research-based approach to come to the source of the lower back pain and to provide a resolution to the problem. So we're pulling, we're holding, and most of the research also suggests 30 seconds at a time. So we're going to hold for 30 seconds, letting the hamstring relax and lengthen. And from there, you'll be able to see the results as far as being more flexible in the hamstrings. The glutes will be able to do a little bit more work. And into the end, we will not have as severe lower back pain as before. Again, this is a research-based approach, and I hope that you see results. All right, well, our first strengthening exercise is the floor wipers, where we work your transverse abdominals. And this exercise, we have our feet planted and we're rotating side to side. It's important to try to rotate from your core, not using your leg strength to rotate. And what you're seeing is the beginner exercise. A more advanced version is to raise the heels off the ground and to again focus on the core as you rotate your legs from side to side. It's also important to notice that you want your shoulder blades to be retracted back and down and also keeping the back of the head pressed against the ground, like you're doing a chin tuck, like you're making a double chin, not necessarily looking up, but just keeping the back of the head down against the ground. So with your whole body stable, your shoulder blades are back and depressed, your back of the head's down, and you're rotating from the core, this is where we really focus on working the transverse abdominals. The muscle fibers of the transverse abdominals run transversely across the stomach, meaning that they're used in rotational movement. Most often, they're highly neglected. They're an underactive muscle. Most likely because when people exercise their core, they typically think of crunches or sit-ups, and they never think of doing any type of rotational type work. And so it's important to incorporate all aspects of the core, not just the front, not just the sides, and not just the back, but kind of thinking of your core as a cube, strengthening all the muscles that go around your spine to promote a healthy back. Well, this is the first exercise and one of the most important, so have fun practicing strengthening your transverse abdominal. Well, our next exercise is floor marching. You keep your shoulder blades back, your core tight, and we're simply going to raise one leg up in the air to parallel, let the leg drop, and then raise the opposite leg. Now it looks very simple and very easy, but what happens is that you need to focus in your mind on the muscle that you want to contract. So while keeping perfect form, you want your shoulders back, your core tight, you want to have a slight arch in the back, slightly off the ground, and that arch is called your neutral spine. So shoulders back, core tight, never let the head come off the floor. You have to keep that core tight, keep those shoulders back, and then once you're braced, go into the motion. Coming up with one leg, up with the opposite leg, making sure that your core is always tight. You see, there's a mind-body connection between the muscle that we want to fire and our mind telling that muscle to fire. So you have to focus on using your core through the abdominal strength as we raise one leg off the ground and then raise the opposite leg off the ground. That same idea, keeping your shoulders braced back, keeping your core tight, promoting a neutral spine, and going through movements. This creates a lot of stability for your LPHC complex, your lumbopelvic hip complex, and it helps you to kind of hold that same neutral spine when you go into movements throughout the day. What we're training is for you to be able to do any type of movement and have the core strength to hold that same neutral spine. And so in this integrated exercise, we're using a dynamic movement while bracing at the core to prepare you for different movements that you'll do during the day. Well, I hope this exercise helps, and I hope that you see results as we decrease your lower back pain. All right, so now we are going to go into floor fallouts. You're going to brace yourself just like the floor marching, so shoulders back, core tight, feeling the neutral spine, holding it there. Except as you notice, we are letting one knee drop, falling out, bringing it back, and then letting the other knee drop. This is strengthening your lumbopelvic hip complex through the frontal plane of motion. Now there's different planes of motion in each exercise, but the fallouts, the ones we are doing now, is through the frontal plane of motion. The one we were doing earlier, the marching, is in the sagittal plane. We want your body to be able to brace its spine in all planes of motion, in the frontal plane, in the sagittal plane, and in the transverse plane of motion. So it's important to strengthen your spine through all planes of motion. So because throughout the day, you're going to be moving in all planes of motion. So it's important to practice that in the training so that it will carry itself out into everyday life. So keeping the core tight, moving from side to side, breathing, shoulders back, and focusing on the core. All right, so we're bracing our shoulders back, keeping the core tight. Now we are going to go into our next exercise called heel slides, where we're sliding our heel out in front of us and bringing it back. It looks pretty simple, but what makes it challenging is when we focus on maintaining the neutral spine. So as you're braced, when you're relaxed, you want to feel a neutral spine, so a slight arch in your back. And you want to maintain that same neutral spine as we extend one leg out in front of you and then the opposite leg out. We never want the spine to round or arch excessively, so we're trying to keep the spine stable through activating our core. This will create more strength of the lumbopelvic hip complex. Common compensations that we see is as the leg extends out in front of us, our ribs will tend to flare up and we will increase the arch in our back. We don't want that, so you really need to focus on keeping your core tight. Another compensation is that as the leg will come up, sometimes we'll lose the neutral spine and our lower back will press into the ground. We don't want this either. We want to promote a nice neutral spine. And in strengthening in this way, we will definitely help to eliminate lower back pain. Our next exercise is floor cobras, also known as Supermans. We try to raise the chest off the ground, keep your shoulders back. Don't let the head look up, but rather keep it chin tucked down towards the ground. From here, raise the knees off the ground, and you could even move your legs out and in as we hold this isometric contraction. Our core should be tight as we go through this movement. The main muscle worked here is called your multifidus. Your multifidus is one of the main stabilizers of your spine. Your multifidus is primarily used through an isometric contraction, which is a hold without movement. So that's what we're doing here. As we raise the chest off the ground and raise the knees, that's an isometric contraction for the multifidus. We could increase this by moving the legs from side to side to get the glutes and hamstrings firing a little bit as well. This is a posterior chain strengthening exercise to help balance out your core and create more postural stability, especially as it comes to the back part of your body or the posterior chain. So we raise the chest off the ground, keep the shoulders depressed down, don't let them come up too high, we don't want the traps to get involved, and then raise the knees off the ground, keeping the core tight. As you continue to practice this exercise, we want 3 sets of 30 seconds, and that's a good place to start for multifidus strengthening. Thank you, and I hope that you see results. All right, well now we are going to go into our strengthening exercise where we pull our shoulders back, we're on our hands and knees, and we're going to extend the opposite arm and opposite leg out, come in and press out again. Now, this is also known as bird dog for some of you yogis or yoga lovers out there. But mainly, what this stretch does is it strengthens our posterior chain. So, the muscles coming through the back part of our body. And what's important is as we're extending out, we're going to find ourselves being unstable. We can find our back arching or rounding, or ourselves leaning from one side towards the other. So, you really want to brace your core tight as you extend out, keeping yourself braced and keeping a neutral spine, and this will work what's called your multifidus. Your multifidus is one of your core muscles located that goes through the spine and helps stabilize your spine and really helps you hold a neutral spine and prevent any type of injury to your lower back. Now again, it's pretty tough to maintain a neutral spine, so you really have to brace at the core, keep the shoulders back as you raise the arm and the leg out in front of you. And when you come down, you could even try to touch the knee to the elbow, depending on how flexible you are. I know for me, flexibility is not one of my strengths, so this exercise is pretty challenging for me as well. As we're doing this, we want to maintain proper breathing. So we're breathing in and out constantly, and we're always keeping that core tight, trying to keep our shoulder blades retracted back and down, and then extending up. When you're in that up position, you should feel the glute fire or the butt muscle fire as you come to that up position. Then while maintaining your core tight, you're bringing the knee towards the elbow and then extend back out towards the ceiling. So coming in and out, this focuses on the multifidus, a core stabilizer of the posterior chain. Most often when people think of core, they only think of your rectus abdominis, or the muscles that make up the six-pack. But they don't necessarily focus on your, well, what I call your backpack. So you really need to focus on developing muscle balance, keeping the back side or the posterior chain as strong as your anterior chain or the front part of your body. Most often, because we don't see the back part in the mirror, we focus so much on the abdomen and so much on the anterior part of the core that the posterior chain gets neglected. This is one exercise that helps balance ourselves out. It helps keep our core tight and keep our core balanced and well developed to help prevent lower back pain. This exercise is called the quadruped, and it's an advanced core stabilizing exercise for the posterior chain. I hope you have fun practicing, and I hope you see results. Alright, our next strengthening exercise is floor bridges. You're going to line yourself up with your shoulders, hips, and knees all in alignment. Then we pull our feet up into dorsiflexion. From here, we're going to make sure that our shoulder blades are back and down. Our ribs tend to flare out, so you got to keep the core tight. Then we're going to bridge ourselves up. And when we do this, we want to focus on the glutes, or the butt muscle as you're coming to the top. Usually what happens is that your hamstrings will want to take control, so you really have to use your mind-body connection to really control the type of movement that we want. Sometimes as you come up, the lower back will either arch or round, so you have to really make sure again to brace yourself as you're coming up and down, keeping your core tight and maintaining a neutral spine as you come up and down, contracting from the glutes. This will help build up the posterior chain. The posterior chain is more on the back part of the body, and in particular, we're strengthening the glutes. The glutes help push the pelvis into a posterior rotation. Now, typically overactive muscles, which we focused on a little earlier, they tend to pull down at the hips, causing an anterior rotation. So to keep our body in balance, to keep our body in proper alignment, we are strengthening a typically underactive muscle, your gluteus maximus and medius. So by keeping the core tight, shoulders back, maintain the neutral spine, and contract at the glutes coming up in the air. This is going to help promote proper strengthening of the glutes, and it will help you hold a neutral spine throughout the day and hopefully prevent lower back pain. Thank you, and I hope that you see results. Alright, we are going into single leg bridges, an advanced technique for gluteal strengthening. Now, similar to double leg bridges, we are going to keep our shoulders back, keep our core tight, keep our ankle pulled in dorsiflexion, and contract at the glutes as we press ourselves in the air. From this position, we should really feel the glutes and hamstrings working. The glutes should be the prime mover as you're coming up and down, and the hamstrings are a synergist or a helper of that movement. But in your mind, you focus on the prime mover, contracting at the glutes as you come up and down. Again, we're trying to maintain that neutral spine by keeping our core tight. One common postural compensation we see is someone will try to start swinging their legs to get better momentum, but we don't want to use momentum. We want to strengthen the muscle. So we keep that leg stable, keep the shoulders braced back, keep the core tight as we bridge ourselves in the air. This will really focus on the glutes and provide all the muscle action to fully activate. So as we're coming up and down, we're strengthening the posterior chain. The glutes and hamstrings, they work together in a posterior tilt of the pelvis, which basically offsets the typically overactive muscles. We touched on that a little bit before, but because the hip flexors get so tight, it becomes so important to strengthen the opposite or antagonistic muscles. In this case, it is the glutes and hamstrings. That is why we are focusing 2 exercises specifically for glute strengthening. You're keeping your core tight, coming up and down, and as you're coming up and down, we want to focus on maintaining a proper neutral spine. It's a little bit more challenging on a single leg than a double leg, but the better you practice and the more you get comfortable at holding that neutral spine, then the better you will be at maintaining that neutral spine through daily movement patterns. And once we get comfortable in daily movement patterns holding a neutral spine, then you can find that your lower back pain will decrease as well. We're strengthening the core as a cube, not only focusing on the front, but also focusing on the posterior chain as well. Thank you. I hope. All right, for this next exercise, we're actually going to use a tubular band, which you can pick up at any sporting goods store. This exercise is used so much in many of the physical therapy clinics, which I've had experience working at, but it's used to strengthen a muscle called your glute medius. So we lie in a side hook lying position, and we really want to keep your core tight. So don't let yourself slouch, try to keep your core tight and retract the shoulder blades back. From here, we are going to open the knee, extending the knee upwards towards the ceiling. We're preventing ourselves from rotating, so make sure you keep that core tight. And we're extending up and down, and you really want to feel this coming through the glute medius, which is in the side of the hip. As you're coming up and down, you should start to feel a nice burn coming through the glute medius. So again, on the setup, we lie in a hook lying position. Keep your core tight, shoulders back, don't let yourself slouch, and then try to only use that leg as you extend up towards the ceiling. More often than not, it's going to be tempting to use our body momentum, rocking from side to side to get that band up. But we have to, again, keep your core tight, keep yourself totally stable, and use your leg to do the motion. You should feel it coming through the glute medius. The glute medius is the main stabilizer of the knee, but the glute medius also helps promote a neutral spine. A commonly overactive muscle is the adductors. We went over that a little earlier. I showed you how to not only foam roll the adductors, but also how to add a little bit of a stretch in during the kneeling stretch. But what we also want to do is strengthen the opposite muscles of the adductors. Now the adductors adduct. They bring the knees inwards into knee valgus. What we are focusing on with the glute medius is the opposite motion. It is a abduction away from the midline. And also with abduction, we get external rotation. Now this movement and this strengthening will help promote healthy movement patterns. As we develop these healthy movement patterns, we will kind of strengthen this muscle to be more active throughout the day. Therefore, you'll be more likely to squat with a correct knee alignment. When you bend down to pick something up, your knee will be trained to be in that proper posture, which will help promote knee health, but also proper lumbopelvic hip positioning. This will prevent lower back pain. So again, we're looking at the root cause of lower back pain. One of the major areas of focus is glute med strengthening. No one ever does this motion, and so the glute medius is often a very weak and underactive motion. This is why it is so important and even necessary to purchase this band from any sporting goods store and practice this exercise to prevent lower back pain and to prevent any other sort of injury even coming towards the knees. So glute med strengthening, I know they use it a lot with athletes, and even a lot of the elderly patients that come into the PT clinics. But yes, strengthening the glute medius definitely is going to help you. I hope you enjoy this, and I hope you see results. All right, this final exercise, we are going to use our band, our tubular band. We're going to place it right below our knees, and we are going to go into more of a functional and dynamic integrated exercise. From here, we line yourself up. The knees should line up with your first and second toe, and also it should line up with your shoulder blades as well. This will promote good posture as we go into the crab walks. As we take the steps, you want to lead with the knee, always keeping the knee over the toe as we step towards the side. You want to make sure that your feet don't turn out. Keep your feet pointed straight forward as you go into that crab walk. More often than not, we'll see some common postural compensations, but what we're going to superset with is going to bodyweight squats with the band. Usually we'll see our knees wanting to fall a little bit too far forward, so we have to make sure that the knees stay behind the toes as we go into the squat. The whole time we are maintaining tension on that band. Immediately we go back into the crab walks from side to side. You should feel this coming through the glute medius, the sides of the hips, where we felt it with the clamshells. Once yourself is aligned, we go back into the squats again. What we are practicing is trying to integrate everything that we've practiced in the previous exercise to this point. We want the glutes to be firing. We want your core to be tight. We want to promote the neutral spine as we go into this functional exercise. Many of the other exercises were more isolated exercises. They focused on one muscle group at a time. This final exercise is an integration technique used as a functional or dynamic exercise to help teach your body how to move properly. It incorporates all the muscles that we strengthened during the activation state, and it helps us to lock in our mind how to move properly. So as we move from side to side, we're making sure that our body just does not rock. We have to keep our core tight. Also, our knees will have a tendency to want to cave in due to tight adductors. So that's where the band comes in to help. And finally, in our squat. Squats are so functional. We do them every day. It's so important to practice our squats and to make sure that we are bending down with proper posture. Well, I hope you all enjoyed it, and I hope that you see results.